What I love most about being tobacco-free is not waking up coughing, not smelling smoke on my clothes when I'm doing laundry, not having to spend money on cigarettes. One of the biggest reasons for me quitting smoking was the fact that everything I loved about cigarettes, that calming, relaxing feeling, was beginning to get outweighed by the irritability and the feelings of disgust when I wasn't smoking, and the feeling like I wasn't doing my body a favor by continuing to smoke. And once the bad outweighed the good enough, I really just had to make the decision to take better care of myself. So I come from a family of many smokers, and my partner is also a smoker. So being a non-smoker, especially someone who recently quit, amongst a sea of smokers, you get a lot of people asking you how you did it, and you can see that even though people are kind of a slave to the nicotine, they still want more advice on how they can become a non-smoker. Does that sound? So I did a few things to quit smoking. I first used the nicotine replacement therapy. I used some nicotine lozenges and started alternating between cigarettes and lozenges to take easier steps into being a non-smoker. I also read a book about quitting smoking and really tried to communicate with friends that supported my decision and get that constant feedback on how this step was going to be really beneficial for me and how I was doing something really amazing for my health. So hearing that positive reinforcement was really awesome too. One of the biggest challenges I faced in quitting was accepting myself as a non-smoker. Like even just coming to terms with the fact that I would never pick up another cigarette again, that was probably the hardest thing because I had known myself for 10 years as a smoker. And it becomes part of you and becomes almost like a friend, so it was like losing a friend. I think I overcame that challenge by constantly checking in with myself. It wasn't a one-time decision to quit smoking. I had to check in with myself many times to make sure this was still something I wanted, to check in with myself about the reasons why I wanted to quit, and make sure that I was still on track and still agreed with the decision that I had made, one day at a time. If I could give someone who's thinking about quitting some advice, I would say listen to the voice in the back of your head that's telling you that it's time, and that voice is valid, and there is no one way for every smoker to stop, but when you really figure out your reasons for quitting, just sticking with that and listening to yourself. So my first stop along this journey was with the nicotine replacement therapy person that I had the consultation with. And that was when all of those voices that were telling me that it was time to quit, that was when I actually sat down and thought it through, and they asked a lot of questions. So that really reinforced my decision. I ended up getting the nicotine replacement, and it was put into my hands at that point. So that's when it was up to me to take it to the next level and really figure out if I was going to use that, like if this was really the time for me. And so it really kind of set me in motion. I think that when you are surrounded by a culture that is committed to healthier living, that makes you want to commit to healthier living yourself. Hello, my name is Melbourne, and I'm a health educator with Health Promotion. I work with the Berkeley Bills Capacity Project, which is an HIV prevention grant, and I have been a non-smoker for 1 year.